Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Let's look at the gastric emptying. So gastric emptying and looking at the factors which regulate the gastric emptying. So the first one is what is increasing the gastric emptying. So increases by the distension. So the distension of the stomach. There is distension of the stomach, and then is the food rich in carbohydrate. So distension of the stomach. So there is a distension of the stomach can increase the gastric emptying. The food rich in carbohydrate also can increase the gastric emptying. Then the isotonic chyme, the stimulation of the parasympathetic nervous system, that is the PNS, and also the gastrin. The use of the gastrin can also increase the gastric emptying. Next, what are the things which decrease the gastric emptying? So decrease in the gastric emptying, this is caused by what? So the decrease in gastric emptying can be caused by the distension of the duodenum. The increase in gastric emptying is by the distension of the stomach. The decrease in the gastric emptying is by the distension. So it is the distension, and this is of the duodenum. So duodenum distension. Next is the food rich in fats. The food which is rich in case of fats. So the factors that decrease the gastric emptying includes the foods rich in fats. Then comes the stimulation of the sympathetic nervous system. Stimulation of the sympathetic nervous system. Then comes the presence of fat in the duodenum and the high acidity of the duodenal chyme. So high acidity of the duodenal chyme. Then comes the hypertonicity, which leads to the hypertonic duodenal content. Then is the breakdown products of the protein digestion in the duodenum. So breakdown products of protein digestion. So breakdown products of protein digestion in the duodenum. That is the presence of any irritation in the duodenal mucosa. So any irritation present in the duodenal mucosa. Then also the presence of the CCK secretin and CCK as well as the GIP. So what this does is it all decreases the gastric emptying. To learn and grow daily like this, please do subscribe.